Hello, my dear PACES candidates. In this podcast, we would deal with a dysphagia case. So your case is Mr. Moon. He is 30 years of age and he is complaining of problems in swallowing for last 1 month. So first thing first, you need to formulate list of differentials for dysphagia. During my examination, I have divided the causes of problems in swallowing in 3 groups: causes outside of esophagus, causes in the muscle of the esophagus, and causes inside the esophagus. So causes outside the esophagus are external pressure due to coarctar, mediastinal mass, or any tumor that can also be esophageal tumor. Causes within the muscle of esophagus: stroke, multiple sclerosis, brainstem infarction or tumor, motor neuron disease, Parkinson's disease, systemic sclerosis, achalasia cardia, hiatus hernia, polymyositis, dermatomyositis, myasthenia gravis, and botulism. Causes inside the esophagus is esophageal candidiasis, usually due to immunosuppression or in HIV patient. After formulating the DD, you would enter the examination room and introduce yourself. By this time, you already know how to introduce yourself. If you don't know, then listen to the previous podcasts. After introduction, you should analyze the chief complaint, swallowing problem. You can use the formula OCATE. O stands for onset, C stands for course, A for aggravating and relieving factors, D for duration, and E for some extra points. Onset: when this swallowing difficulty started exactly. Course: did it start suddenly or gradually? Is it increasing or decreasing or remaining same in 1 month? A for aggravating and relieving factor: is there anything that makes this good or worse? Is it more after swallowing solid food or liquid drinks or both? D for duration: you already know the duration was 1 month, so here you can ask him that is it the first time or did it happen before? E for extra points: since he is complaining of a esophageal problem, so you can ask him about some common GIT symptoms like, do you feel any heartburn, any acid brush, any feeling of sickness, any vomiting, loss of weight or gain of weight? How is your appetite? Is your bowel motion and water work normal and regular? So now we would exclude each of the DD and we would ask 2 to 3 questions to exclude each of the important differentials. Our first differential was causes outside the esophagus: goiter, mediastinal mass, for example thymus, esophageal tumor or any other external tumor. So you can ask him, do you feel any neck lump or neck swelling? Is there any history of cancer or fever or fatigue? You have already asked about weight change. Then to exclude the muscular causes, you can ask him, do you have any history of stroke or mini stroke before? Any history of loss of consciousness, headache, visual disturbance, altered speech, any weakness in any part of the body, any altered sensation in any part of the body, any abnormal gait? To exclude systemic sclerosis, dermatomyositis and polymyositis, you can ask him about any history of skin rash, tight skin, any joint pain, any skin color change. To exclude myasthenia gravis and motor neuron disease, you can ask him, do you feel any weakness in any part of your body? Do you feel your eyelids are droopy? Do you feel weakness particularly at the end of the day? To exclude botulism, again you can ask him about any visual disturbance, muscle weakness, shortness of breath. The main cause of swallowing problem inside the esophagus is esophageal candidiasis, and it is usually due to immunosuppression or HIV infection. So take the history of any surgical operation, dental procedure, blood transfusion, tattooing, piercing, needle sharing, unprotected sexual activity, any history of previous cancer, chemotherapy, radiotherapy, etc. After excluding the DD, you need to do a quick systemic review. You should ask 2 to 3 questions from each of the systems and avoid repeating the questions that you have already asked him. From central nervous system, you already asked him about the headache, loss of vision, and other features of stroke. From CVS, you can ask him any history of chest pain, racing or pacing of heart, any leg swelling. You already asked about shortness of breath. From pulmonary system, you can ask him any cough, phlegm, coughing up blood, noisy chest, bleeding per nose. GIT questions you have already asked him. From genitourinary system, you can ask him more about the urination, waterwork, volume, color, frequency, any frothiness. From musculoskeletal system, you already asked him about the joint pain. Sexual history is also important. Are you sexually active? How many partners do you have? If the patient is female, then always take menstrual history of using oral contraceptive pill, and ask if she is pregnant or not. Then hematology questions are as usual. Ask him about any history of bleeding from any body orifice, any skin redness or bleeding under the skin. You should also take complete medical history, which should include any comorbid factors like diabetes, hypertension, heart disease, any hospital admission history before, any surgical history, and also drug history. Are you on any medication? Do you take any herbal medication or any over-the-counter medication? Do you have any drug allergy or food allergy? What about your diet? Is it normal balanced diet? Ask about family history. How about your family members? Are they doing well? Is there any long-standing disease or similar condition running through your family? Then always ask about social history. You already know what to ask for social history. If you don't know, then listen to the previous Station 2 podcasts. Dear candidates, during Station 2 history taking session, if you find or suspect something specific, then you need to dig into that diagnosis and ask more about that diagnosis to make your diagnosis a solid one. For example, if you suspect that this patient has myasthenia gravis and it is causing him difficulty in swallowing, you need to ask him some specific questions like, do you have vision problem? Do you feel any weakness or problem while combing your hair? Do you think your eyes become droopy during the evening times? Myasthenia gravis is an autoimmune disease and it can be associated with thymus gland abnormalities, other autoimmune conditions like SLE, rheumatoid arthritis, etc. So you need to ask 1 or 2 questions to exclude these associated conditions as well. Then you can summarize the positive findings and ask for his concerns. Let's consider this patient has botulism. So a summary can be, I think your swallowing difficulty is due to a condition called botulism. Botulism happens due to a toxin which is produced by a bug, and I think you have got this bug infection because you have eaten a contaminated food 2 days ago. This condition may be a dangerous condition because this condition can also make your muscles of breathing weaker. So we would hospitalize you and tag you with our multidisciplinary team, including a gut doctor, nerve doctor, and lung doctor, and we would also do some tests and we would give you more information once we have the test results. The common concerns of the patient can be, what is the diagnosis, doctor? Is it dangerous? Is it cancer? Am I going to die? You should answer these concerns accordingly. Next, the examiners should ask you questions. Examiners can ask you any questions they like. So here your diagnosis is botulism, so they might ask you about the differential diagnosis and about the investigations and management plan of botulism. Differentials of botulism can be Guillain-Barré syndrome and myasthenia gravis, and the diagnosis of the botulism is done by proper history taking and full clinical examination. Then stool or blood test for botulinum toxin. Electromyography or nerve conduction study can also be done to check the conduction problem in the nerves. The treatment of botulism typically involves a combination of medical interventions and supportive care. and should be administered as soon as possible to prevent complications and reduce the risk of long-term effects. Some of the treatment modalities are antitoxin therapy. Botulism antitoxin is an antibody that can neutralize the botulinum toxin and prevent it from causing further damage. The therapy is most effective when given early in the course of illness. Hospitalization. People with botulism may require hospitalization, especially if they have breathing difficulty or swallowing difficulty, as well as those with severe muscle weakness or paralysis. Respiratory support. If respiratory failure occurs, mechanical ventilation may be necessary to help the person breathe. Wound care. If the botulism was caused by a wound, the wound will need to be cleaned and treated to prevent further infection. Nutritional support. People with botulism may have difficulty swallowing or require prolonged hospitalization, which can lead to malnutrition. Nutritional support such as feeding tube or intravenous fluids may be necessary.